Good day, ma'am. I am Madeline Reyes, your student nurse from Pamantasan ng Lungsod ng Marikina, and I will be going to demonstrate to you a female catheterization. But before that, you need to review the medical records or the pathological condition of your patient that may impair the passage of the catheter. So next is you need to verify the doctor's order, and this procedure will indicate the urinary retention, the continuous bladder irrigation, and it can use to provide more hygienic care to the bedridden patient. So before entering the patient's room, you need to always perform hand washing technique to prevent the spreading of microorganisms and to avoid the cross contamination between you and your patient. And then you must always provide privacy before doing any procedure to your patient to maintain the dignity by simply closing the curtain or the door. And then you need to identify and greet your client using two modifiers like questioning her if what is her name and then what is the date of her birth. And then next is assume that I have a real patient. So you need to adjust the bed into appropriate height, and then you need to position your patient into a supine position with separating the two legs, or position your patient in dorsal recumbent to get more access in insertion of the catheter. So next is you need to wear gloves. So since I am wearing a gloves, so we can now proceed to the procedure. So next is you need to place a drape under the buttocks of the patient, so to avoid the spilling of the fluid on the bed. And then next is you need to palpate the symphysis pubis of the patient to check the fullness of her bladder. And then after that, you can now discard the clean gloves, discard it, and you can now proceed in opening the catheter kit. So throughout this procedure, you need to maintain the sterile technique. So open the catheter kit away and then towards you, and then side by side, and then slightly tilt it, and then after that pick the sterile gloves and then wear it. After wearing a gloves, you can now pre-connect the drainage bag to the catheter. And then separate the labia of the patient using your non-dominant hand and the index finger and your thumb. And then pick a cotton with a betadine and then do a perineal care. So first is away from you, and then discard the first cotton, and then next is the towards you, then discard. Next is the middle of the labia, which is the meatus, and then discard it. And then after doing a perineal care, you can now insert the catheter to the urethra of your patient. And then once you see a urine flow, you can now adjust the catheter into 2 inches. The purpose of this is to ensure that the catheter is already inserted to the urethra of the patient, and then to prevent the pressure to the opening of the bladder once you inflate the balloon. So after that, inflate the balloon using this 10 cc syringe filled with distilled water. So the balloon serves as a lock into the urethra. So after inflating the balloon, to check that it is already locked, gently pull the catheter. And then after that, check the urine flow and then the urine characteristic, and you can now secure the catheter to the inner thigh of the patient using a non-allergenic tape. Don't place it under the thigh of the patient because it can cause pressure store. And then after doing that, you need to repeat a perineal care. So separate the labia and then away from you, then discard. And then next is separate the labia using your non-dominant hand, and then wipe the, and lastly to the meatus. And now you can now proceed to securing the drainage bag to the side of the bed. It must be put or placed into the below the waist of the patient, because if the drainage bag is placed into the higher than the below the waist of the patient, it can cause backflow or infection to the patient. So after doing that procedure, you need to discard the sterile gloves and then document all the data that you have gathered. That's all.